Hey everybody, it's Johnny Bowden here, and today I want to discuss a very important topic, and it's the brewing controversy over the drug hydroxychloroquine. Now, hydroxychloroquine is an anti-malaria drug, and basically the argument for it, or for using it in the coronavirus epidemic, is this. We know it's safe. There's reason to suspect it might work. We don't have hard science on it yet, but it has worked beneficially against other viruses that may have some things in common with this one. It's long been in use. It has a good safety profile because it's an anti-malaria drug that's been used forever, and people with lupus depend upon it. So we know it's safe. The only thing we really don't have is science. And the argument is, you know what? We don't have anything else right now. Let's give this a try. Now, what are the arguments against it? The argument against it is that there isn't any hard data. And let me explain what I mean by that. Scientists consider randomized, controlled, double-blind studies the gold standard of science and of experiments. We don't have anything like that. We don't know for sure that this particular drug is going to work against this particular virus. This is a lot of intuition, a lot of guesswork. That doesn't mean it's not useful, because the clinical judgment of a physician in the field actually means something. So I think the argument to try this drug, even though it's unproven against this virus, is not a hard argument to support. But here's the hypocrisy. Here's what I don't like. The same people who are arguing so passionately that we ought to give this drug a try, that people are out there, doctors are out there, they're guessing that it's possibly going to be beneficial. We know it's not really dangerous. We don't have anything else. We're connecting the dots and making clinical judgments based on a lot of experience. Why not give it a try? I think that argument is a sound argument. However, those very same people, when you use that very same argument in support of nutritional remedies, botanical remedies, herbal remedies, they will say, oh no, there's no hard science to support that. And that's the hypocrisy that I'm not a fan of. I think the argument for trying this drug with a decent safety profile, and a lot of smart people thinking it might be worth a trial and not a lot of downside so far, I think that's an argument that can be made. But give us the same right to make the same argument when we talk about vitamin C and vitamin D and zinc and selenium and NAC and olive leaf extract and elderberry extract and probiotics. Because there's not hard data to link that particular combination to this virus. There's no hard data on anything that's going to prevent or cure this virus. We're all guessing. But I'll tell you something. Guesses from people who kind of know what they're doing and are making a guess based on their experience and judgment, that's worth something. Doesn't substitute for hard clinical data, but it's not worth nothing. If I'm playing football, Tom Brady's my coach, and he has an intuition that this play is going to work against a team that he's played many times, you know what? I'm going with his intuition. And all I'm asking here is that the same respect be given the clinicians who are supporting and suggesting the use of natural remedies and vitamin and mineral cocktails to support immunity, in the hopes that that may also have a beneficial effect on this virus. You know, about 20 years ago, probably even longer than that, Dr. Robert Atkins of the Atkins diet fame was considered in the medical establishment a pariah, a quack, a know-nothing. He was the subject of contempt. Why? Because Atkins had observed hundreds, if not thousands, of patients in his clinic losing weight on ketogenic diets and not having any ill effects. And he always said, this is worth a try. We don't have anything better for obesity. We got a growing epidemic, let's try this. And the medical establishment said, oh no, you don't have any hard data. And they didn't have any real clinical trials showing the Atkins trial. I mean, those things cost upwards of $100 million to produce, and there's just no incentive to do them. So yeah, they didn't have that hard clinical data. But they had the clinical judgment of some very experienced physicians. And all I'm arguing for is that that clinical judgment means something. You know, Mary Vernon, Dr. Mary Vernon was one of the physicians who worked with Atkins for many, many years. And she told me once, she said, it is time that we restore to a place of honor clinical judgment, educated guesses, and intuition. Because when they're coming from a base of scientific knowledge, that you've studied that stuff, you understand that stuff, you kind of know the background, you've played in the field a long time, then intuition actually counts for something. It's not the place of science, but it has a place in treatment, and that goes for whether you're talking about pharmaceutical drugs such as hydroxychloroquine or nutritional remedies such as vitamin C. Intuition deserves some respect, clinical judgment deserves some respect, and sometimes we got to try things that we've seen work even if we don't have the data yet. This is Johnny Bowden, and I hope I'll see you very soon on the next video. Don't forget to like the channel and subscribe.